working together consistently for a while and you've been putting in a lot of hard work. I really see you showing up and investing in this space, and you're still not feeling well. And typically when this happens and both I and my clients are observing that, like, yeah, I'm putting in the work and things are still, it's hard and I'm struggling, this is where I like to open up the conversation about medication management. What comes up for you as we talk about this? Ugh, I don't know. I know it's an option. I know it could be good for me. I've had friends and family members bring it up too, but I'm nervous that I won't feel like myself. Like, what if I take it and I'm just like a shell of who I used to be? Totally valid concerns. And before we dive even deeper into this conversation, I just want to preface that I am not pushing one way or the other. I am here to let you know what your resources are, explore those resources with you, and support you in whatever decision that you make. So that being said, is it okay if I offer a reframe to what you just shared with me? Yeah, no, totally. I get it. I appreciate the resources and I'm open to hearing the reframe. You said that you were worried if you took medication that you wouldn't feel like yourself anymore. And so I'm wondering, have you been feeling like yourself lately? When is the last time you felt like yourself? Yeah, that's true. I really haven't felt like myself in a long time. Yeah, and that sucks. Like, we want you to feel like yourself. We want you to feel better than just feeling like yourself, right? We want you to be able to access joy and happiness and fun. What medication can do is potentially give you space to feel like yourself. Something else that we've been talking about in therapy is your substance use. And so, even though you have reservations about medication, you have been self medicating. Those coping skills, they make sense. The self medicating, it makes sense. And also, things are not getting better. That's also true. Yeah, I have been self medicating. And I know we've been working on that, and I don't know. I guess like the side effects of medication kind of freak me out too. Yeah, absolutely. Let's talk about side effects. So, of course, when you make the choice to take medications, there is the risk of experiencing side effects, or it takes some trial and error to figure out what medication is the right match for you. It's really important to work with a doctor, prescriber who is a really good fit for you, where you can have honest conversations and advocate for yourself. I can be here to support you in terms of like monitoring for side effects, noticing when there's shifts in your moods that we need to be concerned about, noticing shifts in behaviors that we need to be concerned about, and assisting you in advocating for yourself with your doctor, making sure that they are in the loop. And I also want to add that there are also side effects to not taking medication. We talked about how when you use substances, you feel groggy the next day. It takes a hit on your relationships. There's shame, there's guilt that comes up. Okay, I hate to say it, but you make a lot of good points. Okay, let's say I am open to possibly getting on medication. What would be the next step? Have a conversation with your doctor or meet with a prescriber, talk about your concerns, get a perspective from them about what they think an appropriate treatment would be. It can just be a conversation. Do you have any referrals? I can send you some referrals. I'll type up an email after we end session and send those your way.